COVID-19, the lungs are normally more noticeable when they are not functioning properly. So I spoke a little more with Dr. Schaman on why that is.
Strengthening the muscles and respiration is very important for anyone who has had COVID-19 and good for anyone in general. Doctor, how can this be done?
Well, when I first heard of some of the unique challenges with COVID-19, I immediately thought that, it's kind of interesting that my work with breathing in my clinic, which has been going on now for quite some years, might all of a sudden have a new use. And I heard that people who suffered from COVID-19, those that actually exercised aggressively their lungs while they had in the early stages of the disease and were suffering from it, actually had benefits. Whereas normally if somebody has a sickness or a disease, they kind of lay low until they're over the worst of it before they become physically more engaging. Mm-hmm. Well, in this particular case, several very vocal television personalities, both in Britain as well as in North America and US, indicated that you have to really push the lungs in the early going. And I thought that was interesting, but it kind of, in a way, made sense. So really, there are three phases that extra breathing exercise might help someone. One is as a preventative, because we know from years and years of work that if we have fitness in a certain area, then that area is less likely to be impacted by disease. So if you get good fitness of your lungs, should you get COVID-19, you will have probably a little less impact from it. Secondly, the one that I wouldn't have anticipated is the fact that when you have the disease, you can actually affect the course of the disease in a beneficial way by doing aggressive breathing exercise. And of course, the third way is by exercising the lungs after you've already recovered. And we know from many studies and science behind COVID-19 that when people recover from this disease, unfortunately, that they are left with some lesions in their lungs that various kinds of imaging show. And we don't really yet know what impact that might have on the long term of these people that have had the disease.
And the American Lung Association is saying that COVID-19 is the #1 lung disease in the world right now. Would you agree with that?
Oh, absolutely. There's no question about it.
And the alarming number that you said that we discussed last week was that people lose half of their lung function between ages 30 and 70. This is something to be thinking about way before COVID-19 even existed and even after. Can you explain how we can keep up with that and how we can strengthen our lungs in the meantime?
Well, that's what was going on before COVID-19 came on in my life. In 2007, I started the harmonica program with a normal harmonica. 2011, we adapted our program to the new medical harmonica, which made it much more effective, but it's a different kind of playing. The musicality was maintained by having all those beautiful chords, and you play rhythmically, and the strengthening of the lungs, the breathing muscles of the lungs specifically, has been staggering, really. I would never have expected that. We're actually getting an improvement of 50 to 60% in the breathing muscle strength, which is beyond anything I would have ever thought could be possible.
Thank you, Dr. Schaman, for your time and for all of the years that you have dedicated to this.
Thank you for having me.
We'll have this interview on KITV.com. That's it for this Wellness Wednesday. Good morning, Hawaii. We'll be back.